insurance covers the cost of a variety of services that promote sound physical and mental health, including physical examinations, diagnostic testing, surgery, and so on. Employers usually enter into a contractual relationship with one or more insurance companies to provide health-related services for their employees and, if specified, employees' dependents. It's important to mention that healthcare in the United States is classified as a multi-payer system. In a multi-payer system, more than one party is responsible for covering the cost of healthcare, including the government, employers, labor unions, employees, or individuals not currently employed. A multi-payer system stands in contrast to a single-payer system, in which the government regulates the healthcare system and uses taxpayer dollars to fund healthcare. This happens in Canada and some other countries. Single-payer systems are often referred to as universal healthcare systems because the government ensures that all citizens have access to quality healthcare regardless of their ability to pay. These approaches to healthcare coverage have been at the heart of political and social debates over the years. The predecessor to company-sponsored insurance benefits appeared in the late 1800s for mining and railroad workers. These companies hired doctors to provide medical services to employees. The hazardous work of railroad workers, miners, and employees in other industrial businesses led to frequent illnesses, injuries, and employee absence from work, including costly disruptions for businesses. In those days, working-class employees could not realistically afford to pay for medical services, so employers quickly recognized that bearing such costs would help maintain a more productive workforce. The Great Depression of the 1930s gave rise to employer-sponsored health insurance programs. Widespread unemployment made it impossible for most individuals to afford health care. Since the 1970s, substantial emphasis has been placed on managing costs, and consideration has been given to providing coverage to the uninsured. Healthcare costs have risen substantially in the U.S. This is due in part to longer life expectancies, advances in medical research, diagnostic testing and treatments, aging baby boomers, and the tendency for the health profession and family members to treat death as unnatural. In 2011, 69% of private sector employers used some form of employee-sponsored healthcare coverage. Single coverage in March 2011 had an average annual monthly premium of $367.18, family coverage at $853.41 per employee. Since the 1980s, many insurance companies have extended family coverage to unmarried opposite-sex and same-sex domestic partnerships. In 2011, employee contributions varied considerably. The annual contribution ranged from $32.50 to $127, and family covered $126 to $768.87. Companies offer employees coverage under health insurance programs either on an individual policy or group policy basis. Individual coverage extends insurance protection to a named employee and possibly to his or her dependents, including a spouse or children. The insurance provider issues separate policies to every covered individual and conducts transactions directly with them. Group coverage extends coverage to a group of employees and their dependents under a single master contract agreement. Insurance providers issue master contracts to employers, professional associations, labor unions, and trust funds established to provide health insurance to designated people. These entities are known as group policyholders. The underwriting process for this is somewhat different. Group policies generally do not exclude any group member based on health status. Instead, they focus mainly on establishing the premium for the master contract, usually expressed on an annual basis. Insurance providers use experience ratings by actuaries to set these premiums. Experience ratings specify the incidence, type, financial cost, and insurance claims for groups.